नमस्कार, मैं हूं डॉक्टर के अग्रवाल और मेरे साथ में हैं डॉक्टर AC धारीवाल, द डायरेक्टर ऑफ NCDC. Let's listen from the horse's mouth about new diseases. One of them is scrub typhus, which is responsible for 50% of the cases in Gorakhpur, a disease which needs to be learned and revisited by every medical practitioner, that any patient with fever, lymphadenopathy, hepatosplenomegaly and rash always keep the possibility of scrub typhus, and now scrub typhus tests are also available in the society. And if if the test is not available, don't wait for the test report. Start the antibiotic doxycycline. And now, the more important, apart from scrub typhus, we have learned dengue, chikungunya, we have learned H1N1, we have learned about scrub typhus. We need to know something about leptospirosis, otherwise it is going to come back as a surprise to us. A large number of cases may appear. Specifically in Mumbai, this time when there was flood, leptospirosis is on alert. Let's talk from the horse's mouth about leptospirosis.
Leptospirosis is a disease which has been reported in India for last many years. Earlier days, at some of the places we were calling it Andaman fever or the local name, and we were not able to diagnose it as leptospirosis. But these are now retrospectively, when investigations were done, they were confirmed as the cases of leptospirosis. Leptospirosis is mainly prevalent in our coastal states. Like I mentioned the name of Andaman Nicobar, their problem was more particularly in north, but then from Tamil Nadu, Karnataka, Kerala, Maharashtra, Gujarat, Goa, from all these coastal states also leptospirosis have been reported, and have been reported in outbreak proportion also, and it usually have been reported after the rains, once flooding is there. So we need to understand the dynamics. Now leptospira natural habitat is rodent, and in rodent it comes out through their urine, and if somebody is having some abrasion, maybe micro ulcer, and is coming in contact with water which is infected, which is contaminated with infected urine of the rodent, then there is a possibility of entry of leptospira in the human, and then there can be manifestation in form of fever. It could be as jaundice or it could be as pulmonary manifestation. These are the two main group of manifestation which are seen. But again, it's curable, and it's preventable also. Like Dr. Aggarwal had mentioned about Mumbai episode. I was in Pune last week only, and the government of Maharashtra, and in particular their health minister, chief minister, all they sit together and they have already issued guideline with the help of experts that doxycycline has to be posed in those who were exposed, who came in contact with the stagnant water, because the leptospira is endemic in those regions. There would be possibility. So already instructions have been given, and my request would be through
So
this.
doxycycline as a preventive, as a prophylaxis?
Yeah, exactly.
So if you have been exposed to, if you are barefooted or if you are not wearing any clothes,
Yeah.
and if you have been exposed to the flood,
Yeah.
you can take prophylactic doxycycline for how many days?
It has to be taken for the period of exposure, otherwise minimum for 5 days.
Minimum for 5 days. So you can take prophylactic medicines for doxycycline
Yeah,
with that.
one.
Then what next?
And second thing is again suspicion. As I said, that right now H1N1 transmission is going on in all these areas where leptospirosis is likely to happen.
So co-infection can come.
So co-infection, and we should have again high suspicion index for leptospirosis also.
So the message which comes is that in those areas where there is a flood, leptospirosis can come because of the urine of the rodents. H1N1 in any way is there in the air, and dengue chikungunya can also come because water stagnation will come maybe 10 days from the flood time, you may get. So therefore co-infections are common. We recently had a medical doctor in Delhi who had both dengue and H1N1. And don't forget that the co-infections are going to occur. The one message which Dr. Dhariwal has given is very clear, and that's a take-home message for the general practitioners. We know fever with jaundice, viral hepatitis is ruled out. In viral hepatitis, jaundice appears, fever disappears. So co-presence of fever with jaundice, yellow fever in India is not there, so therefore that doesn't come into the differential diagnosis. The fever with jaundice, look for malaria, but there the jaundice will be less than 5, and SGOT, SGPT will always be less than 400. Look for dengue, sometimes dengue hepatopathy can come, which can cause jaundice, but always look for leptospirosis. If you have fever with jaundice, look for leptospirosis, and if not treated in time, these people can die. And the good news is again, the two new diseases, scrub typhus and leptospirosis, both the treatments are doxycycline. So that's going to come back as a Ramban in cases with fever where you find that doesn't look like to be a viral fever, and then in those cases, doxycycline may be the drug of choice that will cover both the things. How to diagnose leptospirosis?
Yeah, that's very important, and that is the point I wanted to communicate also, that laboratory diagnosis of leptospirosis is little tricky. It's not very straightforward. The investigations which are done, and just for information of all our colleagues, sometimes misdiagnosis has been done by even good laboratories, because leptospirosis needs very specialized, there are different type of serovers, and detection of specific serovers is important, and not many laboratories they have expertise to differentiate between these things, and they sometimes overdiagnose. So we need to, number one, use our clinical acumen, and then in laboratory also, if we are getting supportive evidence, then that has to be examined in totality, and what we call as the eco-epidemiological diagnosis, that we know that dynamics, the disease transmission dynamics, that it occurs only in those areas where there is a possibility of infected urine coming in contact with, means in flooded area or where water stagnation, not otherwise. And there is some element of pH of the soil also, which determines the survival of the leptospira. So that also has to be taken care of, and as I said, it's reported more in coastal areas, not in dry areas where, so to say, the acidic pH of the soil has been observed.
So coastal areas in the country, post-flood, fever with jaundice, with or without pulmonary symptoms. And remember, in that season, in that area, flu is also common. So if you only look for fever and flu, fever and pulmonary symptoms, lung symptoms, you may think it to be a simple flu, and if you forget to look at the jaundice. Jaundice is the trick for diagnosis of leptospirosis and treatment. I want to end with one message. There is a old traditional thing, बिल्ली रास्ता काट गई, रुक जाओ उसके साथ में. बिल्ली रास्ता काट गई, उस जमाने में प्लेग था, आज की डेट के अंदर में लेप्टोस्पायरोसिस है. बिल्ली रास्ता काटी का मतलब है कि उस एरियाज में चूहे हैं. If there are no rodents, the cats are not going to be there. So cats indirectly represent that in these areas there are rodents, and if there are rodents, and if you are in a coastal area, and if you find there is a post-flood situation, leptospirosis should be in your differential diagnosis. So if you don't ignore fever with jaundice, it can be leptospirosis. Thank you.
Thank you.